Welcome to the Ransomware Alert program. Earlier today, we attempted to present this program online and it failed due to platform issues. In order to make this information available to you as promptly as possible, we were able to obtain the recording of the presentation and have presented it here in video or recorded format so that you may have the benefit of the program. Hello, my name is Steve Frew. I'm the presenter on this program. I'm Vice President of Risk Management Consulting for Johnson Insurance in the Healthcare Division, working out of Madison, Wisconsin. As a caveat for this program, I want to let you know that while I am an attorney, I am not your attorney. So this cannot be viewed as legal advice and is actually meant for a risk management awareness presentation. In order to download copies of this presentation, you may go to this PDF download location on your internet browser and click to download and save. Ransomware is the biggest cyber threat for 2016, according to most of the industry publications. This has actually gotten worse as the year has gone on, and as you will see as we progress through this, the ransomware issue is going to be with us for a while and is causing a lot of difficulty for many of our clients, and in particular the healthcare sector. As you can see from these headlines, we have had an ongoing media awareness that is bringing this issue not only to the forefront for hospitals, but for our clients and for the regulatory authorities as well. You will note that these aren't just issues about can't get into a file or whatever. When these particular healthcare systems are attacked, it amounts to a state of an emergency, because all of our equipment can be tied up, documentation, lab work, and all of these others, as you will note from the quote, are often rendered out of commission, leaving us in a position to function on paper only for those services that are not computer dependent. Those services that are computer dependent are essentially knocked out. An amazing figure is almost half of the hospitals surveyed have been hit with ransomware in the last 12 months. As we have seen from the past headlines, this is an ongoing crisis of escalating proportion. The FBI indicates that as many as 4,000 successful attempts per day have been going on in 2016 in the U.S. This is up from 1,000 a day in 2015. That's a significant increase, and the healthcare providers are the primary target. Now, very briefly, ransomware is a malicious software used by cyber criminals to seize control of your computer. It then grabs your files, starting with what it's programmed to believe are the most significant files in your system, and then it encrypts them. It turns them into code that cannot be read by your computer, and the cyber criminals then demand you pay them ransom or money for the key to get your data back. The typical demand looks something like this, and it is often the first indication that anyone has that they have been hacked. The screen you see right here is CryptoLocker, which is one of the more common ones. But the distressing thing about this is there are multiple systems, multiple ransomware systems out there, and they are proliferating with variations as many as 1,200 variants a day, which means that your standard virus software may not catch the latest and meanest version. Now, the big issue for healthcare is one that had been being talked about up till approximately the first part of July, and that is whether or not ransomware is a HIPAA breach. When they seize your data, does the hospital or healthcare provider now have to go through the full HIPAA compliance on notifications and things like that? The answer was set out in July by CMS and OCR, and the Offices of Civil Rights answer is very simply that a breach is defined as access, acquisition, use, or disclosure of personal healthcare information in a manner not permitted by the HIPAA privacy rule. In this case, they declare that a breach has occurred if you have a ransomware attack because the electronic PHI has become encrypted. It is acquired then. Control over the information has been considered acquired and controlled and out of your hands. Thus, it is a disclosure that's not permitted by the privacy rule. This has been debated by a number of attorneys and risk managers and HIPAA experts, with about a 50-50 spread before this came up. But OCR makes it clear that unless you can demonstrate, that is, the healthcare provider can demonstrate under their definitions that there is a low probability that the PHI has been compromised, it is presumed to have been a breach. Now, having said that, the only way you're going to be able to prove that it has not been accessed is through a detailed forensic investigation that takes time. That particular aspect of the ransomware situation typically has come after you've made a decision on what you're going to deal with, how you're going to deal with it, in terms of stopping it, containing it, and preventing its spread. We'll talk about that in a bit. You must have, of course, your own HIPAA compliance procedures. You should know how to use them. The problem with this one is that massive amounts of information is being seized that may or may not be clear whether that includes PHI or not. All right. So the best example I can give you is a recent party that we dealt with ran a business. This was not healthcare, but the loading dock, which you have in your hospital or healthcare organization, received an email that referred to an attachment with a shipping information on it. The person on the loading dock, thinking that it had come from FedEx, because of the very good job of describing the email with the proper credentials and such from FedEx, clicked on it. It entered the system and ultimately was discovered. They shut down. They made a mistake later in attempting to see which files had been compromised. They clicked on the system again for a brief instant. It spread throughout the network. Now, in the end, they got a ransom demand, and they believed that they had approximately 700,000 files of an accounting nature that were seized by the software. When they later paid and got the key and decrypted what the bad guys had, the bad guys actually had 2.1 million files. And this is something that leaves you in a situation where if you don't even know for sure what they took, it's going to be very difficult to make sure that OCR will believe that you successfully prevented any disclosure. So the HIPAA security rule also comes into play, and this guidance from the Office of Civil Rights makes it clear that they expect that our security incident procedures should be able to detect, contain, and eradicate the software to remediate vulnerabilities that permitted the attack in the first place. They expect us to recover from the ransomware attack, analyze the evidence to determine if you have reporting requirements, and then incorporating every lesson learned in the revision of the overall security management protection for your system. So just how does this get into your system? As I mentioned in our example, the primary mode is email, and it comes from a number of approaches that cyber criminals have incorporated into a product that they sell on the dark web, like a cyber criminal supermarket. They go out and can buy an exploit kit and attach it to some sources of getting into your system, and they're in business. This is typically done by email links. And these are done with social engineering and spear phishing approaches, which means that they do their best to make it look as if this is coming from a legitimate source, asking you to open something that while you didn't expect it, it appears to be normal. Once that happens, and it can also happen as attachments to legitimate software, or even just because something has been picked up on your browser as an extension. The results then are it accesses your system, locks everything down, and sends you the dreaded ransomware notice. A slight variation of this was announced just a few days ago. In this case, rather than the typical attachment, this is leaving you a voicemail. And you think voicemails are legitimate because there's no reason in the past to worry about it. The email tells you the zip attachment has a voicemail message in it in a WAV format file. However, when you unzip the file, it's going to run rampant through your system, lock down all your files, and will only give you back your money, your files, if you pay them around $500. That's the current going price. You should be aware that these amounts are not consistent. Each criminal has his own demands. Each criminal has a different way that they wish payment. Typically, you're not going to generally get it an awareness before it's too late. You may have somebody who comes in and gives you a hint by saying to your IT department, I think I just clicked on something maybe I shouldn't have. Now that could be because they had a sudden realization that this is acting weird when they clicked on it, or it may be because they've gone and tried to access something on their desktop workstation, and all of a sudden things aren't working properly. If you get this warning, you are ahead of the game somewhat. Or you might get a notification from whatever software you have monitoring your system. In the recent past, there's been a new class of of monitoring software come out that looks for not just the virus signature or whatever, which is the standard way that your protective software, virusware, works. But in this case, this one looks for activity, and it sets up basically either bait files that are going to look good to a software coming in to try to seize important data, or they will scan a broad number of files. But the bottom line is they are looking for the encryption activity going on. If they say, if this software suddenly sees a number of files being converted over into an encrypted format, it will shut it down, lock down the situation, notify your IT, notify the user, etc. So under those circumstances, that's your second best. But in reality, even a second or two advantage that this gives you can mean hundreds of thousands of files have been saved. Now, there are some important things that these notifications are going to give you, but this, as I say, is the most likely way you'll find out. Most other breaches are not found for as many as 200 days. In this case, as soon as this is finished, it's going to flash up the notification that you've been had. And they're not shy about it. So, in all probability, this will be the trigger that you will see most often. So what do you do now? The answer to this is somewhat problematic since you don't have your IT expert standing right next to you, perhaps, to give you instructions. The important thing is to isolate the infection source from the network. If you can disconnect, unplug a workstation that has been contaminated, along with any connected printers, scanners, or other devices that are associated with it, then you should unplug that, and hopefully, if you get it soon enough, you get it before it has spread on the system, on the network. All right? You may not catch that in time. The important thing to know here on this and all other variants of malware is that you don't want to plug this thing back in until you are prepared to deal with it. In one hospital, we had a problem with malware. The hospital removed the malware from the system. A couple months later, they suddenly discovered, because of some protective devices on their system that were new, that the system was reinfected and sending out files to Eastern Europe. In this particular case, 65,000 patient files were sent to Eastern Europe. That was set up for an identity theft scam, not for a ransomware situation. So they weren't notified of it, but they were able to shut down again. They had already lost all of these files, but what they discovered was a workstation that had been online when they were first infected had been removed from the system, no longer in use, and then before they were able to contain it the first time, and then it was put back on when a new hire needed the computer months later. The result was that particular computer was still infected, and it went on to infect the entire organization. Now, the most important thing is for you to have an incident response plan. Now, in reality, many people think they do, but they are particularly limited in their scope. They deal with some things, but not ransomware. You need your system incident response plan to be thorough and be revised constantly to anticipate new developments in the ransomware and other types of malware field. The first thing you do after disconnecting the computer is activate and follow your incident response plan. You're going to need thereafter to determine what type of ransomware is involved. Over in the upper left-hand corner of this particular notification, and most of them, it tells you what the type of software is. In many cases, this tells the IT staff which files are going to be corrupted first. They're also going to know what basic file designation, like your doc files on Word, what kind of suffixes are going to be added to these files to indicate they're encrypted. You need to know how long it's going to be before the files are lost. In this particular case, you'll see 54, 15, 15. You have 54 hours to meet these ransom demands. In some cases, if you don't meet the ransom demand within that period of time, the system will simply destroy or permanently disable any access to those files, even if you have the encryption key. So it becomes a clicking time bomb for you. It also tells you the ransom demand in the payment process. That's all this information over here. Payment process may be Bitcoin. Problem with that is, if you don't already have Bitcoin, you may have a 4 to 5 day delay in your ability to get it. In the case of our dock worker incident, they started out with a demand of $500, 1 Bitcoin, and because they didn't have that, because it took some time to determine their strategy on whether they would pay or not, they ultimately had to pay 4 Bitcoins because they ran over. A Bitcoin is a digital currency which has an approximate value right at the moment of $500 per Bitcoin. They're not available at your local bank, etc. So it takes some time to get them online to be able to transfer them to the anonymous destination. They then will or will not send back the release keys. We'll talk about that a little further. Following your incident response plan, you're going to need to notify a lot of people quickly. Your IT experts, to get them involved and make sure that they are protecting what remains of the system as completely as possible. If you have cyber insurance, we'll talk about that at the end for just a few minutes, you should notify your cyber insurance company for a couple of reasons. One, your coverage may involve ransom coverage. It may also involve the insurance company's forensic and compliance teams that can be immediately deployed to help you handle this situation with experts that you may not currently have. If you have a separate forensics and compliance team, you're going to need to notify them. And in the end, you may have to notify Office of Civil Rights. That is typically going to occur after the dealing with the immediate emergency. The FBI and local law enforcement also wish to be notified. Now, on ransomware, the FBI is going to tell you that they don't want you to pay the ransom, but that they cannot prohibit you from paying the ransom. In reality, there's very little that the FBI can do to help your current situation, but by reporting it, they're going to be in the position to help prevent it in the future for someone else. So it is worthwhile notifying the FBI and your local law enforcement in whatever order your cyber insurance or your forensic experts recommend. Then you're going to have to determine a response strategy. And your responses are basically limited. You can restore from backup if you have a backup. Now, why do I say if? Well, almost everybody backs up, but the new versions of these programs go after your backups almost as quickly as anything else. They may even be the first thing to be taken out. So if you have a backup, then you're going to have that as an option to clean your computer system, restore your active files, necessary files from backup. That's obviously going to be the best. You don't have to pay anybody in that case. You have evaded the bullet. The next option is attempting to decrypt the files. In most cases, I'm not aware of any that the FBI have claimed an ability to decrypt. So if they can't do it, the only one who might would be Snowden, but I don't know about that either. Some places simply say that what they got was not that critical. We managed to contain it. We're just going to write it off and not pay it. And they, in fact, then lose that data because it's encrypted. Some people may store that data against the day that a decryption capability might arise. But for the most part, if you don't pay the ransom, you're not able to decrypt it. The data is lost. And of course, the last option is the one they want you to take, which is to negotiate or pay. Now, what's your risk here? Well, the real risk is massive loss of data, massive loss of time, even if you have paid the ransom and got the release key. Our client with the example problem, it took them 200 hours to decrypt all of the files that were encrypted. That is, as you can tell, is a long, long time. Even if you have multiple employees tasked on it, you are going to suffer a substantial period of impaired operation. So, in the risk analysis, you want to have conducted the cybersecurity risk and analysis. If you haven't done it up to now, you're supposed to have been doing it under HIPAA. That risk analysis should be done annually, every time you have a security incident, and anytime there are material system changes, because all of that changes your exposure and changes your risk. The big element, from my point of view, is that training your staff is essential. That's because of the ransomware cases, 91% are the result of employee error. This is not meaning that the employee screwed up the system intentionally or that they did something, anything other than doing what they thought they were supposed to do, clicking on something, or letting information out in some manner that allowed the person to penetrate your system with their malware. Okay, the issues for training, as far as I'm concerned, are you need to repeat frequently. Just giving an annual security briefing that puts everybody in a big room and puts them all to sleep with technobabble that they don't understand. You should be doing short and interesting programs. You should offer them in different formats. Several of our organizational components have programs out there where they're in cartoons, where they're in movies, when they're in videos, when they're in slide format. There are a lot of formats. Change it up so that people don't get bored and think they already know it. And even if they know it, they forget that most of the time they aren't following what they knew. The next thing is they should not be totally generic. Much of this can be, but you should train your people on your policies. The idea of giving a generic training to these folks is simply not useful. For one thing, they don't retain what they don't perceive to be relevant to them. And then if you train them on one thing and your policies say something more detailed, when the feds come in from OCR, they're going to look at your policies and say, did they ever train you on this? You want to be able to say truthfully, yes, you have. I endorse training specific to the role. That means that somebody who is in billing probably has different circumstances. They're going to see different types of communication. They're going to have different things to access. They need to know the rules specific to what they do. So giving somebody in the emergency department a training that's identical to the person in dietary is probably not going to help you a lot. You should conduct drills regularly, at least twice a year, on your incident response plan. So you know what you're going to do, how you're going to do it, and how to implement it. Now, that may include live restorations of backed up documents and things. In talking to a client recently, their comment was, well, we did some drills, but we found out our system was so awkward that we really don't train on it anymore. Well, the point of the whole thing is to find those spots where your program or plan is not viable and change it. Not simply ignore it because it's too hard. If it's too hard, it's sending you a message. And the next thing is a rather recent development. A number of companies now, especially those associated with malware software protection systems, do unannounced tests. They send emails that are fictitious to your employees. And then if an employee clicks on one they shouldn't, it takes them to a harmless site that basically tells them they just killed the company or shut down the hospital or whatever. People who have been caught up in these things are really distressed when they get caught. But the point is not to intimidate these people or to fire them or anything else. It's to give them real life experience that they will retain on looking for the details that might tell them that they are about to click on something dangerous. And when you teach your staff, they need to understand that manipulating trusted employees is one of the biggest things these folks do. They are out there deliberately to trick your employees, and your employees need to know that they are the solution that prevents data breaches. Them not falling for the sucker ploys of the hackers is critical to the hospital and to your patients and to your employees. Now, I want to mention defensive tactics. First of all, backups. Big issue is that you want these stored offline and off-site. You want all the critical information backed up. Problem is frequency. Number of our folks back up once a month. That's giving them access, the bad guys access to a whole month of data. And how much time is it going to take for you to manually recreate all of that data? And again, you have to have tested your ability to take those backups in an emergency situation and get them up and running quickly and effectively. As I mentioned before, there are the variants of the ransomware that track down your online and system backups and the restore points on your computers and encrypt them also. So you need to isolate your backups. Some people refer that to air gapping or putting air between your system and the backup. No physical connection. There are, again, with those backups, the issues of how effective it is by how frequent it is and how easy it is to use. And now we have some services that are offering isolated storage options on the cloud. By this, they are providing what they suggest are air-gapped backups on the cloud. That may or may be correct. You're going to have to carefully have your IT people analyze what the service does. The important thing is that if you're storing information that is covered by HIPAA, you have an issue storing on the cloud. And the biggest issue with that is almost none of these services, although a few more now will do it, will give you a personalized business associate agreement, which, as you know, is absolutely required for HIPAA compliance because these folks are handling PHI. We also mentioned your incident response plan. So you need to know, do you have a plan? Have you practiced the plan? And after the practice, did you revise your plan? So that we're in a position to learn from each of these tests or practices and make our system more and more foolproof. You also need a business continuity plan. And in those, you have to know what specific programs, data, or systems are essential to you surviving if you have to go on for a period of time. And you have to make sure that you have plans for restoring these and have tested these as well. Now, your incident response plan sometimes is included as a portion of a business continuity plan. These don't have to be separate, but the functions have to be addressed. Another issue is penetration testing for determining whether outside malware can be inserted into your system. And this is a function that costs varying amounts. It's a function that has white hat hackers attack your system. This is pretty much a reality of today. You need to be doing those kinds of preparedness drills, paying somebody to find out whether your actions in protecting your system are good, better, or outstanding. You're also going to be looking at your IT side as part of your response to attack. The IT side's job is to recognize the attack, isolate and minimize it, remove it, and restore you to operations. On the operations side, that is management of the hospital or health system. Your job is to implement an incident response plan, notify law enforcement, request immediate assistance from your insurance carrier cyber response group. Most of you have good IT departments, but they have a huge responsibility. There are thousands of criminals working every day, 24 hours a day, to come up with the newest and best theft device. So you need outside assistance in these situations, not only to control the situation, but to get you back on. And that is, paying does not guarantee you will get it back. Your data might not be returned to you. These are criminals, after all. These are bad guys. Not being ethical or not telling the truth is not going to keep them up at night. It does not guarantee that they're not going to come back at you to pay a higher ransom after you paid the first. This happened to one hospital. Paying can also put you on a repeat list. But just because you didn't pay doesn't mean you won't have repeat attacks. Recent statistics show that hospitals typically have been hit 4 or 5 times once they were hit first. And if this basically is testing whether or not you are still leaving yourself vulnerable to their ability to control you. There are also other criminals. And we have to assume that they're going to tell their friends in their shady dealings, and you will get tried again. And as far as the feds are concerned, the FBI considers that this encourages this criminal business model, and they consider it to be terrorism. And in fact, many insurance policies refer to this as cyber terrorism. So what should you do now? Start out, assume you are going to get hit. If you think that because you've been hit, or because you have a good IT system, or because you think your employees are smart enough not to be sucked in, or you think you're a rural community hospital and nobody's going to bother you, you are wrong. Assume you're going to get hit. Take action now. Meet with your IT department to get a situation report or SITREP on what your protection level is, what you're doing now, what's been done. Are they on top of it, at least as far as they know? Make sure that if they're not already doing it, they start regular patching and updates on software now. This is the biggest vulnerability that lets hackers into your system. Begin isolated backups now. Make sure that when you isolate the backup that it's off-site and not accessible, so that not connected to your system, so that it cannot be sucked up in this. Think HIPAA. Think of all of the requirements, such as updating your information inventory and risk assessment, and updating your privacy security policies. Train your staff on your policies and procedures and how to recognize threats. Update your continuity plan and test it. Update or create an incident response plan and test it. Consider penetration testing and consider cyber insurance. I'm not going to tell you you have to have cyber insurance, and I'm not going to tell you that cyber insurance solves all the issues with this problem. I am going to, however, say that I consider it a valuable tool. Why? First of all, in the long run, you're going to cover the cost of business interruption with this kind of policy. It also, the one big, you notice this is big and green highlighted here. This is what I consider the absolute reason to have it. They provide for forensic services and crisis consulting when you have a problem. It's absolutely essential that you get this expert service if you don't have all that expertise already contracted and in play. It's going to cover your mandatory notification expenses, monitoring services, and call center services if people's information has been stolen. It's going to cover, in most cases, your HIPAA fines. Now, the big but if is depending on your limits, all right? If you have a basic policy that has $50,000 in benefits, you're going to use that up in almost no time. So I would suggest that you talk with your insurance agent and have a credible level of protection. Just thinking because it's in your policy you're protected is unfortunately a mistake. Now, for more information, if you need to get a hold of me with questions, etc., please forward your questions to my email address, sfrew@johnsonins.com, or contact your Johnson Insurance agent. As I said earlier, you can download the slides from this program at medlaw.com//ransomware notes.pdf. And that's ransomware with a capital R. Please note that.